It is my privilege to stand with you today. I am so honored to be in your company. Thank you to Dean Galea for the invitation, and it's always a pleasure to be with my good friend, Associate Dean Harold Cox. Together, Dean Cox and I served on the DentaQuest Foundation with the goal of improving oral health for all by collaborating with partners in communities across the United States, connecting key stakeholders, raising awareness, and supporting solutions through policy, funding, care, and community, a true public health approach to oral health. But before I continue, congratulations to this amazing group of graduates. Take a moment to pause and breathe in the significance of this moment in time and what you have attained. Acknowledge your hard efforts to get here, your work, your scholarship, commitment to public health locally and globally. I salute you. Okay, graduates, now acknowledge your safety nets and the supports that helped you get here along the way. This chapter of your professional journey, your family, your friends, your loved ones, the little ones, who also deserve your and our thanks and appreciation. So thank you to all the family and friends who are here today. Safety nets are important for us and help us get through dark days. So it is true, I have been an advocate, public servant, agency executive, Department of Justice expert, and college professor. Yes, I really can hold on to a job. These positions reflect my professional journey, different avenues of ensuring social justice and equality, particularly in improving access to physical, behavioral, and oral health. I don't know how we ever segregated oral, physical, and behavioral health, quite frankly. And yes, this is what half a state government looks like. A $19.4 billion budget, 22,000 public employees, and thousands of private partners, ranging from academic medical centers to tiny grassroots organizations. All of them matter, and a whole lot in between. And we must never forget that behind every dollar and statistic is a very real person. As someone now responsible for the health and human services that touches the lives of 1 in 4 residents in the Commonwealth, and in fact, our public health programs touch the lives of everyone in Massachusetts, I am fully aware of the profound responsibility inherent with it. Humbled that even with $19 billion, not every child is safe from harm. 4 people die every day in this great Commonwealth from an opioid overdose. That there are profound disparities in health, economic, and educational outcomes, depending on one zip code. The largest component of the state budget is Medicaid, representing 40% of overall state spending, growing at double-digit increases. When I came back into public service last year, so this is my 4th paid return to public service, when I came back into public service last year and saw the extraordinary rate of growth of the Medicaid program, now representing 40% of state spending, I have to tell you, academia was looking really good at that moment. I didn't come back to public service to slice and dice our way out of Medicaid spending. I came back with the goal of trying to make it sustainable. Because the reality was Medicaid spending at its rate was crowding out all the other things that we know are so important to health in our communities: social services, housing, mitigation of homelessness. You all know it, you've been studying it and living it these past few years. But Medicaid is not sustainable. Now some would advocate for additional revenues, but the current political environment in Massachusetts does not support more tax revenues. That may change, but it's not the current reality. So since I didn't run back to academia, what did we do? So for the past 15 months, we've been engaged in a very public process, that's the social worker in me, to restructure a program that essentially has had the same operating model since the mid-1990s. Now, I don't know about you, but I think healthcare has changed a lot since the mid-1990s. So as we restructure the Mass Health program into a sustainable public insurance program with very strong benefits, we do so with the knowledge that 1.85 million people depend on Medicaid for their health care coverage here. And the Mass Health population is not a homogeneous group. It's made up of low-income, non-disabled, and disabled adults. It's composed of disabled and non-disabled children, and youth and elders. Our system must meet their disparate needs. Additionally, unlike any other insurance program, Mass Health also provides long-term services and supports that no other insurance program in the United States provides. This restructuring is occurring through a public health lens. Yes, a public health lens, truly integrating physical and behavioral health care and creating far stronger linkages to address social determinants. I don't need to tell this group how important social determinants are significant factors in health outcomes. The path forward must truly put the person in the center of patient-centered care, rather than the historic provider-centered care system that we have. Trust me, it's a lot easier to say it than to accomplish it. But for the past 15 months, we've held stakeholder groups and facilitated many stakeholder planning meetings across the state to listen, to learn, and to shape together a Mass Health program that meets the triple aim. Public health is community health. Our collective commitment to health promotion, disease prevention, it must also include the promotion of mental health. I applaud this School of Public Health for its commitment to mental health. Given the tremendous burden of disease that is mental illness, there must be new pathways of promotion and awareness, early intervention, development of evidence-based treatments, reduction of the burden of disease, and research into greater understanding of mental illness. Mental health must be a public health priority for the 1 in 4 adults and the 1 in 10 children diagnosed annually, here and abroad. You know, Massachusetts is fortunate. When I travel around the country, I'm always glad to come back to Massachusetts. We have the lowest rate of uninsured individuals in the country, less than 4%, far better than the national average of 10%, and certainly states such as Texas, which hover almost at 20%. But coverage is essential. It is only one part, however, of the health equation. It doesn't necessarily translate into availability or affordability. Individuals who are Hispanic, for example, represent 10% of the Massachusetts population, and yet are 20% of individuals who are uninsured. And when we look closer at health status by zip codes or neighborhoods, there are alarming disparities. You've heard it this morning. Zip codes must not be a predictor of a person's health status. We must make a pledge in this Commonwealth to eliminate health disparities. We can do it here. This is not just government's responsibility, it is our collective responsibility. It is our collective public health responsibility. You leave with a strong foundation in public health, but remember, here's the bad news out there. We are always a work of progress. We must always be learning. You leave not alone, but with the comfort of knowing you're supported by the village that is the Boston University School of Public Health and the broader public health community. That is public health. A few final thoughts, starting with a note of caution. Today's technology has transformed our insatiable quest for information on a 24/7 basis. You can Google almost anything, from an answer to a date. But you can't Google your values. That comes from the heart, nurtured by experience and strengthened by your academic public health experience at Boston University. From years of experience and many mistakes along the way, I offer the following. Words matter. They can be embracing or stigmatizing. I urge caution when you describe populations. Nothing could be truer when we think about addictions. What are the images that come to mind when we say addict or junkie? It may be awkward and yes, more words, but I will always refer to individuals as addictions, as a person first, and then their illness. Their illness does not completely define or consume them. It also presumes a homogeneity, which doesn't exist. Yes, there are similarities, but not completeness. The mentally ill, as if that is one defined group, a group of illnesses that range from depression from schizophrenia, not a one-size-fits-all. I have 3 generations of family with serious mental illness, and it was completely devastating the day that my niece, who has schizoaffective illness, was described in a waiting room as the schizoaffective down the hall. Be positive or search for the positive. As I used to caution my social work students who had mastered the art of cataloging a person's or family's deficits, to find strength or positives to build from. Every community has a strength if you search. It may be tiny, but it offers hope. Engage civilly and respectfully. Despite the discordant national politics, for the most part, we engage civilly in Massachusetts. A Republican governor, a heavily Democratic legislature and state, a bipartisan cabinet, I'm his sole independent, and anyone who knows me knows that about me. With a focus of making government responsive to the needs of the people and our communities, you can work across the aisle. You can channel your advocacy to good change. Are there enough resources? Of course not. There will never be sufficient resources to eradicate every health issue or societal condition, but there is a commitment always to keep people and communities at the forefront of our political and policy discussions here in the Commonwealth. Public service needs you. If not now, perhaps later. Public service is a privilege. It's about channeling your advocacy into shaping good public policy and programs. I'm thrilled to work with a group of subject matter experts as commissioners, including the wonderful Monica Burrell, who's the Commissioner of Public Health in Massachusetts. She has tremendous subject matter expertise with strong interpersonal skills. And you know, you never know. Someday you could be a public health commissioner or Secretary of Health and Human Services. Your graduate education provides a strong platform for public service. Think about it. Finally, unplug. At least on occasion, look up from your gadgets long enough to make eye-to-eye contact with another being. Have passion for your field of interest, compassion for the individuals and communities that you are privileged to work with, and commitment to a healthier society, locally and globally. Be well, take care. My profound congratulations to you today.